finally pharmaceutical magic bullet for weight loss? Meet Ozempic, semaglutide, a drug originally approved for type 2 diabetes that's showing unprecedented results on this scale. In clinical trials, participants lost up to 15% on their body weight in 68 weeks. Sounds too good to be true, but a spoiler alert. Yes, but there is a catch. Let's dive in. Ozempic is a once-weekly injectable formulation of a semaglutide, a glucagon-like peptide-1 GLP-1 receptor agonist. By mimicking a natural gut hormone, it enhances insulin secretion, slows gastric emptying, and crucially for weight loss, suppresses appetite and increases satiety. It's not a stimulant. It works by rewiring your hunger signals in the brain. Appetite regulation. Semaglutide binds to the GLP-1 receptors in the hypothalamus, reducing cravings and the pleasure response to the food. It slows gastric emptying. Food stays in your stomach longer, which helps you fill with smaller portions. Metabolic effects. It modestly increases resting energy expenditure, meaning you burn more calories at rest. In a pivotal step 1 trial, nearly 2,000 non-diabetic adults with obesity or overweight received either semaglutide 2.4 mg weekly or placebo, plus lifestyle counseling. After 68 weeks, semaglutide group lost a mean of nearly 50% of the body weight, whereas 2.4% on placebo. Nearly 70% of the treated participants achieved greater than 10% weight loss compared to 12% with the placebo. Waist circumference decreased by an average of 13 cm, a key marker for the metabolic risk reduction. The SUSTAIN 7 trial compared semaglutide with dulaglutide in the type 2 diabetes patient. Over 40 weeks, semaglutide 1 mg led to mean weight loss of 6.5%, outperforming dulaglutide 3%. Real-world observational study mirrored these findings. Clinical report average losses of 10 to 12% body weight in a patients using semaglutide for at least 6 months. While Ozempic's label is for diabetes, the higher dose formulation, 2.4 mg weekly, is marketed as a Wegovy for obesity. Insurance coverage can lag behind, and many off-label prescribe Ozempic for weight management, leading to access and cost challenges. Most side effects are gastrointestinal and dose-dependent, peaking during the first 8-12 weeks. Nausea up to 40%, diarrhea or constipation 20 to 30%, abdominal pain and vomiting 10 to 15%. These usually subside with a gradual dose escalation. Rare, but serious risks include acute pancreatitis and gallbladder disease. There is also a small signal for a thyroid C-cell tumor in the rodent. Thus, human relevance remains unproven. Ozempic isn't a free pass to binge. Trials combine the drug with a structural diet, approximately 500 kcal per day deficit, and exercise plans. When treatment stops, weight regain is a common unless lifestyle changes stick. Think of Ozempic as a powerful tool, not the magic wand. A monthly supply of Ozempic can exceed €800 out of the pocket without insurance. Bigger costs can be even higher. Some patients face prior authorization hurdles or step therapy requirements. Financial assistance programs exist, but the economic barrier remains a major catch. Ozempic's promise collides with the systemic healthcare gaps. Marginalized groups, especially low-income individuals, uninsured populations, and racial minorities, face disproportionate barriers to accessing semaglutide. A 2023 study showed only 18% of eligible Medicaid recipients receive coverage for obesity medications. Without structural reforms, a therapy heralded as a revolutionary risk, reinforcing health inequities. Ensuring broader access means rethinking insurance policies, expanding public fundings, and training clinicians to avoid unconscious bias in prescribing. Weight loss should be science-driven, not privilege-restricted. Most step trials extend up to 68 weeks. Longer-term data are limited but encouraging. In extended challenge, weight loss plateaus rather than rebounds, provide treatment continuous. However, sustained reimbursement and adherence are key to maintaining benefits. Can semaglutide reduce cardiovascular events? Early signals suggest potential benefits, but dedicated outcome trials are ongoing. What about combination therapies? Though GLP-1, GIP agonists may offer even greater weight loss, but comparative data are pending. How to optimize therapy duration? Researchers are exploring drug holidays, tapering strategies to manage costs and side effects without major weight regain. Yes, Ozempic works remarkably well for weight loss, outperforming almost every other long-term pharmacotherapy. But it's not a standalone solution. You need commitment to diet, exercise, and ongoing medical supervision. Side effects can be managed, but costs and access remain sustainable barriers. For those who can navigate the system, semaglutide could be the game changer, but only when paired with a sustained lifestyle change. Ready to learn more? Talk to your healthcare providers about whether semaglutide is right for you, because effective obesity management requires both cutting-edge medicine and everyday habits.